You know, we always say a healthy workforce is a productive workforce, right? It's just common sense. But what if the system we all count on for health is actually failing half of that workforce? In this explainer, we're diving into a really eye-opening report. It uncovers this huge, kind of invisible crisis that's hitting workplaces everywhere. And it all boils down to one really tough question. And here it is. The question that the whole report is built around. It's direct, it's maybe a little uncomfortable, but we have to ask it. Is our healthcare system biased?
Well, when you look at the data, and we're talking decades of it, the answer is a pretty resounding yes. It turns out our medical system has this fundamental blind spot. And the consequences, they're not just small inconveniences. They can literally be a matter of life and death.
Okay, let's take a classic example. Heart attacks. We all think we know the signs, right? That crushing chest pain, shortness of breath, pain down the arm. But here's the thing. Those are predominantly male symptoms. For a woman, a heart attack can show up as nausea or jaw pain, or even just extreme fatigue. And when all the textbooks and training are based on that male model, you can see how these crucial, life-saving signs get missed.
And this really gets to the heart of the issue, what the report calls medicine's male default. Think about it. For centuries, the male body was just the default, the standard for all medical research, for all practice. And the result is a system that, without even meaning to, is just not built to serve half the population.
And look, this isn't some abstract theory. This has real-world consequences. After having a heart attack, women are a staggering 50% more likely to be misdiagnosed. Just let that sink in. They're getting sent home, or they're getting less aggressive treatment, all because what they're feeling doesn't line up with a checklist that was designed for men.
And it's not just about heart attacks, not by a long shot. Across 770 different diseases, women are waiting an average of 4 years longer than men for a diagnosis. 4 years! That's 4 years of living with pain, of not knowing what's wrong, of conditions getting worse, all because their health is being judged against the standard that just doesn't apply to their bodies. And behind all these numbers are real people. Listen to this quote from one woman in the report. She says, "I've been told many times that I didn't display symptoms normally, only to find after testing that I had it. How frustrating is that? And it's an incredibly common story. Being told your pain is wrong or it's all in your head, only to find out years down the line that, no, you were right all along." So the problem doesn't even stop at diagnosis. It carries right on through to treatment. The report calls this the medication gap. You see, women's bodies often metabolize drugs differently than men's. There's clear evidence for 86 common drugs that women process them more slowly. So what does that mean? It means a standard dose can actually lead to more severe side effects. It's this one-size-fits-most approach, and frankly, it can be really dangerous.
Okay, so this is the point where a medical problem becomes a full-blown economic one. Because these health issues, they don't just stay behind the closed doors of a doctor's office. They create this huge ripple effect that washes right into the workplace.
So the big question is, how does a medical blind spot like this actually turn into a problem at work? Let's connect the dots.
This quote from the report just says it all. Even though studies equate menstrual pain to heart attacks, we're expected to suck it up. Wow, that just cuts right to the chase, doesn't it? It points to this huge cultural issue we have at work, the idea that just because a type of pain is common, it should be ignored. But that's exactly the expectation that millions of women are dealing with month after month.
And that expectation to just suck it up has a very real, very measurable cost. Get this, in just the last month, almost 70% of the women surveyed said they lost anywhere from 1 to 5 days of productivity because of their health. We're not talking about a small hiccup here. This is a major drain on company resources, not to mention on people's actual well-being.
And you know what's wild? That number, nearly 70%, is probably way lower than the reality. As one woman wrote, "I have always just pushed through the pain. I suspect this is the case with many women." And she's right. The true cost is hidden. It's hidden by a culture where so many women feel like they have no choice but to work through serious pain just so they won't be seen as weak or unproductive.
All right,
Now let's follow the money, because this isn't just about lost time. It's about a real, direct financial penalty. The report gives it a name, the gender health tax. And tied to that is this deep lack of trust in the workplace.
So what exactly is this gender health tax? Well, it's pretty simple. It's the extra money women end up paying for healthcare because the system itself is so bad at managing their needs. We're talking more doctor's visits, more tests, more out-of-pocket costs, all just to get to the right answer.
And the numbers here, they make it crystal clear. On average, a single woman in the US spends almost 7% of her income on health insurance premiums. For a single man, it's under 4%. That gap is a huge financial weight that just gets heavier and heavier over a lifetime. It affects savings, retirement, everything.
And on top of that financial strain, there's this feeling that employers just aren't serious about fixing it. One employee said it perfectly. We can talk about it, but there's little willingness to act if it requires resources or change. You can just feel the cynicism in that, right? This belief that all the corporate talk about support is just that, talk. And that trust deficit, it is staggering. When they asked women if they strongly agree that their employer provides adequate support for their health needs, you know what the number was? Just over 10%. Only 10%. That is a massive, shocking gap between what companies say they're doing and what their employees are actually experiencing.
Okay, so we've spent a lot of time laying out the problem, and it's a big one. But the good news is, the report doesn't just leave us there. It pivots, and it offers up a clear, actionable solution. And it frames this whole thing not as a burden, but as a real strategic opportunity for companies that want to get ahead.
So what's the path forward? It really comes down to 3 key things. First, centralize. Bring all the women's health benefits together in one place so they're actually easy to find and use. Second, redefine. Think about women's health as more than just fertility. We need to include support for chronic conditions like endometriosis. And third, and this is so important, listen. Actively use employee feedback to find out where the real gaps are and then actually close them. It's all about building a system that responds to what people truly need.
And that really leaves every business leader, every manager, with one final crucial question. After seeing all this data, the lost productivity, the financial inequality, that huge trust deficit, you have to ask yourself, is supporting women's health just another expense on a spreadsheet? Or is it one of the single biggest strategic advantages your company could possibly unlock?